primary biliary cirrhosis can also cause liver cirrhosis. Primary biliary cirrhosis is basically cirrhosis, which is fibrosis and scarring of the biliary tract, as well as destruction of the bile duct. So bile duct is where the bile flows from the gallbladder here and the liver. This can cause cholestasis, which is bile flow blockage. So if we zoom into this area, here's our gallbladder and here's our bile duct. We can have blockage within the bile duct, which therefore will cause bile coming from the gallbladder and from the liver to not flow through, and therefore can accumulate in the liver and other tissues. It's mostly asymptomatic, but symptoms of primary biliary cirrhosis itself is fatigue, fever, jaundice, and hepatomegaly, as well as itching. Now, alkaline phosphatase, bilirubin, and cholesterol are increased in the blood in this condition. Why would bilirubin be increased? Because bilirubin is usually eliminated within the bile. However, because the bile flow is blocked, bilirubin will go into the bloodstream and cause jaundice, yellowing of the skin. And primary biliary cirrhosis is known to be an autoimmune disease because the body essentially attacks its own biliary tract and bile duct. And so you diagnose it with anti-mitochondrial antibodies towards this bile duct. Another cause of liver cirrhosis is an inherited disease known as Wilson's disease. Normally what happens is that we would absorb copper from the stomach here. The copper will come into the liver and then will be secreted via the bile and basically eliminated if necessary, or will move around the body. However, in Wilson's disease, we have a mutation of what's called the P-type ATPase, which normally transports the copper in the liver, from the liver into bile, to be incorporated into ceruloplasmin, so it can leave the liver and circulate around the body, or be eliminated. But because of Wilson's disease, the copper accumulates in the liver and the brain because it cannot be transported into the bile and incorporated into ceruloplasmin. Altogether, Wilson's disease can cause liver disease and neuropsychiatric symptoms. So problems with copper accumulating in tissues, such as the liver, can cause liver cirrhosis. This is also the case with iron accumulating in the liver. When we have too much iron in the body, in our liver, this is an example of hereditary hemochromatosis, in which we have an accelerated rate of iron absorption from the intestines. With all this iron we can have iron just depositing everywhere in the body, in different tissues, including that of the liver. Hereditary hemochromatosis can cause hepatic cirrhosis, along with hypopituitarism, cardiomyopathy, diabetes, arthritis, and hyperpigmentation. To diagnose hemochromatosis, we just essentially take blood and see if there's low transferrin saturated with iron, because transferrin is a carrier protein for iron. So if there is no transferrin, or there is but with no iron attached to it, we can say that iron is somewhere else. It's accumulating somewhere in the tissues in our body, such as the liver. And so to treat hemochromatosis, we can do phlebotomy, where we withdraw blood to reduce the iron levels in the blood, and then we put new blood in with no iron in it. Or we can use chelating agents such as deferoxamine. What deferoxamine does, is that they bind to iron to enhance iron elimination from the body, because we have too much iron in the body. We need to eliminate it. And the last cause of cirrhosis that can fit into this diagram can be autoimmune hepatitis, where we have our own antibodies and immune cells attacking hepatocytes, the liver cells. and there is about a 10-year survival in 90% of the cases. No specific diagnosis. There can be increase in gamma globulin levels in the blood, which can be used for diagnosis. Now, there are other causes of liver cirrhosis, such as glycogen storage disease and galactosemia. You can look up what these conditions are. Anyway, this whole diagram shows some causes of liver cirrhosis, which is a progressive severe liver condition characterized by fibrosis and scarring, causing abnormal liver function, as well as death to the hepatocytes. Next video, we will look at some symptoms and complications that accompany liver cirrhosis itself, which include enlargement of the spleen and portal hypertension. So that's the next video.